me. Now, this year's theme is Take the Right Path, My Health, My Rights. It highlights the critical link between health and human rights as well. It calls for breaking down barriers that prevent access to healthcare, fighting stigma as well, and also ensuring dignity and equality for people who are living with HIV. Now, joining me to have this conversation and, of course, share some very, very much needed insight on the matter is my special guest this morning, Dr. Lilian Ochayi, the brilliant Dr. Lilian Ochayi, if I can say so myself. She's a public health physician. She's passionate about improving healthcare systems and promoting health equity. Dr. Lilian, great to have you once again with me on Lagos Talks.
Hi, good morning, Ayo. Thank you so much for having me.
Absolute pleasure. You taking the time out to join me because I know, doctors tend to have very, very busy schedules. So it's great to get you this morning to have this conversation. And for you out there listening to us and you'd love to be a part of this discussion, please come one, come all. You can send messages on WhatsApp on 0809 444 0981 0809 444 0981. You can also call on the studio line if that is what you would love to do to talk to us in the studio. 0201 4489981. That is the studio number. And we're streaming on YouTube. You can find us on YouTube out there, Smooth 981 FM Lagos. Now, to get into this conversation, we just need to look at, have an idea of the current HIV/AIDS landscape in Nigeria. It's safe to say that in recent decades, Nigeria has made strides in tackling HIV/AIDS thanks to government initiatives, global partnerships as well, and even community efforts. Those have played, roles. That yet the statistics remain quite sobering if you think about it. I mean, over 1.9 million Nigerians are living with HIV. With women and young people disproportionately affected, and this is due to various challenges like limited healthcare infrastructure, insufficient funding, that lingering stigma when it comes to HIV and AIDS, it is still very persistent. But I mean, away from what it is that I've read, Dr. Lillian, I mean, from your professional perspective and everything that you've seen recently, can you paint a another picture or a clearer picture of the current state of HIV/AIDS in Nigeria? I mean, what progress have we made up until this point, and what other challenges are still remaining for us to deal with?
Right. Thank you. Thank you very much for that, Ayo. Currently we can't say that we haven't made progress, right? I mean, compared to previous years, we have about 1.9 million people living with HIV now, and about 1.7 of them are on medication. So that's not a bad figure, although there's
Yep.
still a lot that we can do, right? Progress that has been made so far with increased access to treatment. So Nigeria has made, substantial strides in expanding access to the antiretroviral therapy, which is
Mm,
the treatment for HIV and AIDS. And, like I said, we have about 1.5, 1.6 people, million people receiving these medications as opposed to previous years. And this is a significant increase. And these medications also have, been made free, and also testing is free, so
okay.
people. Yes, yes. So people, this has also helped. This is progress, right? And then prevention programs, campaigns also have been done to increase awareness. Then we have introduction of the pre-exposure prophylaxis, which is a medication that people can take if they're going to, those that are among the vulnerable groups, like those that, if you have a partner that is HIV positive and you are
Mm,
negative, to prevent you from being infected. Then mother to child transmission also has been reduced. There's been efforts with all that also, and then community engagement. But yes, we still have challenges, right? Stigma, and discrimination is like one of the major ones. Funding and resources, despite the programs that the progress, there's some inconsistencies in some of the funding for HIV programs. And
Okay.
like you mentioned earlier, healthcare infrastructure, things like that. So these are the aspects that we still have challenges in, but there has been progress. So that's not completely bad, right?
Baby steps, I guess. I mean, we actually we're talking about this issue of infrastructure off the air. It still remains a huge problem when it comes to
Yeah.
the health sector in Nigeria across
Mm.
different facets, as it were. We'll take a quick break right now, and when we come back in, we'll continue the conversation, looking at, of course, this year's theme, what its significance is, and a whole lot more concerning World AIDS Day. Keep it tuned to Lagos Talks on Smooth 98.1. First break of the day.
Was short. It felt like we've not even said anything.
Yeah, because I think it's because we didn't start at 9 on the dot. So like maybe 9:07, nine
Okay.
eight thereabouts. Yeah. I mean, from here, the next week is at 9:30, so we can get a couple of things in
All right.
between now and then. Most definitely.
I posted the World AIDS Day thing on my status yesterday, right? And a friend of mine was like, was like, oh wow, that he hasn't heard about HIV in a long time.
Is he
That
in this
this is like
Lagos?
a crude reminder.
Is he in this Lagos? Because I've heard things happen on the island, though. On the island, that things are happening.
Have you? It's in Lagos. So maybe they do good boy.
Well, it's possible. It's possible, but it's still a reality,
Have you?
unfortunately. In fact, you should be listening, listening to everything that they are saying. Mm.
He's listening. He's listening.
Okay, almost back in.
All right. Sometimes your voice gets really low, like I struggle to hear. I don't know if it's from my end or something.
So yeah, it could also be from this end as well because this system in the studio, it's special. That's the best I can describe it. Like if I'm not speaking like directly at it,
Directly.
it's kind of
Yeah.
like I think the mic for this particular HP is like unidirectional. So if you're like to the side, it
Mm.
won't really pick. If I move to the side like this, it's difficult for you to hear me as opposed to like
Oh, yeah. I didn't
back.
get that. Mm.
uh I don't know why they designed it like that, but hey, it
Okay.
is what it is at the end of the day. Alrighty, welcome back into Lagos Talks on the Smooth Breakfast on Smooth 98.1. Love music, love life. We love conversation as well, and that is why we are here at this point in time having great conversation. My name is Ayokunmi. Welcome along to the journey with us this morning. And by us, I mean me and my very special guest well, not in the studio, but she's here in spirit, in the person of Dr. Lilian Ochayi. She's a public health physician and it's a World AIDS Day 2024 special. The theme for this year is Take the Right Path, My Health, My Right. We're talking about that, bringing these issues to the fore. And you can join us on the conversation. Hey, any questions you might have answered, anything that could be confusing about this particular issue, this is the opportunity for you to clear the air and get those questions or those queries answered. So you can send your thoughts in on WhatsApp. That's one way. The number is 0809 444 0981. 0809 444 0981 is the WhatsApp number. You can also give us a call on the studio line, which is 0201 4489981. YouTube, we're streaming live at Smooth 981 FM Lagos. And it seems like there's a call coming in. Let's take this one. Uh, yeah. Hello, good morning.
Morning.
Hello, very good morning to you. What's your name? Where are you calling from?
Yeah, my name is David.
All right, David, welcome to the show. Talk to us.
Thank you. It's something that takes on for me because I've been living with it since 2007,
Oh, wow.
15 years, and
Okay.
meditation I think 2013 or thereabout. So, but it's something that I just want to encourage as many people as possible. It's not a death sentence.
Mm.
Many people commit suicide. We've had to save some people from committing suicide as a result, and currently they're having fantastic lives, having their own families, having their own kids that are all HIV negative.
Living, living,
Uh,
living normal lives, as it
yes,
were.
living in fact, if you see people who are medication, they're actually helping that number of people that don't have HIV.
Right.
So it's not a death sentence. People shouldn't feel fine. The very first reaction is usually one of shock. So just be calm. Don't take any rash decision at that early stage. Get good information, get counseling. That was what helped me. I actually had very good friends that were checking up on me on a daily basis, encouraging me with scriptures and all that. So it really helped me. I have a family, I have children, I have a life. Let me just quickly round up talking about the rights of those living with HIV/AIDS. It's very difficult. It's difficult to get jobs when you pass interviews and then you go for medicals and then they go mute on you. So there are so many things, and then anybody gets to find out that you are HIV positive. It's like you're carrying one deadly. It's actually a deadly disease, but not
But it's
what's
not
it called?
contagious like that.
Yes, exactly. In fact, malaria kills faster. Malaria kills faster than HIV/AIDS. Hepatitis B kills faster than HIV/AIDS. For crying out loud, I've been living with HIV/AIDS since 2007. That's almost 20 years
That's
now.
quite a while. Yes, indeed,
Yes,
David.
so
Indeed.
we need to work on the human rights of those living with HIV/AIDS. They are human beings like every one of us.
Right. Right.
People should also be very, very careful. I'm still surprised people still have sex these days without condoms. It's no joke. Once you have it, for now there's no cure. So, and if you get to the point where you have to start taking medication, then you have to take it for life. So think with your head, not just with your heart. Protect yourself. Sometimes the pleasure is not worth the entire risk. Protect yourself, take your medication. If you by any chance discover that you're HIV positive, please, it's not a death sentence. There are so many people who have lived with it for 30 years.
All right.
Or
All right.
40 years. So please, it's not a death. Don't kill yourself. You are just it's going to be a waste. You can have a very fruitful, fulfilling life.
Indeed.
Like,
Thank you so much, David. Thank you.
thank you very much, and thank you, Dr. Lilian. You guys are the true heroes. You make things easier for us. Drugs are easily accessible now. Sometimes you don't even need to go to the centers. They will send it to the pharmacies closest to you. They will check up on you regularly. Someone will call me on Friday. So you guys are doing a good job. For those that are listening, that are sponsoring, God bless you. They are saving lives. They are helping people.
All right, David. All right. Thank you so much, David. I mean, that's a very brave individual out there. I mean, coming to talk about, talk about his particular story. I mean, since 2007, he has been, living with the HIV infection, and he's lived well, should I say, a normal life, taking his medication, and of course, doing his thing. I mean, Lillian, these are the sort of things that we're trying to bring to the fore to let it be known that it is not the end of the world if the right things are done, if the proper measures are put in place, if people live their lives in a certain way.
Exactly, exactly. I really commend him for coming on to, speak about his experience. And like this is basically one of the main issues that people living with HIV face. This stigma and discrimination thing is very serious, and it's we need efforts to reinforce the importance of respecting and upholding universal human rights.
Mm,
And now in Nigeria, people with HIV, they suffer all sorts of discriminations. And like he mentioned in the workplace, actually in Nigeria, there's a law that prohibits, workplaces from doing these testings before hiring people. And even with this test, you're not supposed to say, oh, we're not going to give you a job due to your HIV status. But
that
I see that some private organizations still do this. Okay, and this is another way of discriminating, which is not supposed to happen. And people's rights are not being protected, and then they have the right to privacy. I mean, like confidentiality. People apart from individuals that are trying to get jobs, even when people go to hospitals to have, they call them routine tests without letting the individuals know. They are supposed to let them know, consent should be
mm,
taken before taking people's blood to run this test, because there's supposed to be pre-counseling before the test and also post-counseling to prepare their minds. So these
okay.
are things that we need to reinforce. People have the right to health, just the way people that are not infected also have the same rights. So these are issues that we really need to work on, and it's still a major issue in Nigeria.
Definitely is a major issue in Nigeria, and you just begin to wonder what it is that needs to be done to, should I say, change this mindset. And Nigeria is such a peculiar place where we have a number of laws, but when it comes to implementing these laws, it doesn't happen. A new law is put out there and it's enforced for maybe a couple of weeks, and then after that, everything just
It's
goes
like
down the drain,
everyone
and
forgets about them.
everyone forgets about them. And as you've alluded to, there are laws against these tests that would then lead to discrimination because of one's HIV status. It is something that definitely needs to be dealt with at the end of the day. I
Right.
mean, what more can we actually do? These organizations or these companies, do we call them out? Do we report them? I mean, because it is such a sad thing to see when someone, because of the HIV status, are denied something that they are very eminently qualified for at the end of the day. It could be a pool of different people. That person is maybe two or three times more qualified than the next best person, but because,
Exactly.
oh, HIV positive status, they are, pushed away or they're overlooked. It's a sad state of
Exactly.
affairs.
Yeah, and these organizations, even according to this act, they are supposed to create a supportive environment so that employees living with HIV and AIDS are able to continue working under normal conditions for as long as they are medically fit to do so. But they are just denied of these rights because, people are scared. And I feel a lot of these things are still because of some misconceptions that people have, about how people can be infected with HIV. Despite
Mm,
information that keeps going around, people still just want to not act based on this information, I believe, for some reasons. I don't know, but I think we need to still make this point loud and clear so that people know that it is not right to discriminate, and also it is safe to live with people that are HIV infected, and there are ways that they can be transmitted, and without being involved in ways in these practices, then
mm.
you are not at risk of getting HIV. So we need to create more awareness, basically.
Yes, indeed, we do. There's a lot of educating that needs to happen. And that
Yeah.
is something we're going to delve into on the other side of this. We're going to look at education and really how important it is, the role it plays in opening the minds of people to better understand what HIV is and what it is not as well. For that and a lot more, keep it tuned to Lagos Talks. This is Smooth 98.1. Okay, I actually wasn't expecting that caller to call. Yeah, because from experience or from what I've seen,
Yeah.
people who live with HIV do not like to talk about it like that. It's
Yeah.
like, it's a shameful thing.
He must really be feeling it like he just want, and he I could sense how, he really wanted to encourage others to not allow it affect their self-esteem or get them depressed and all. He's probably just trying to help others that are like him. I mean, that was really brave.
And there's a lot of people out there. Goodness knows how many more people would have, decided to off themselves because of that, because they feel, oh, that's the end, oh, game over.
Yeah.
Yeah, it's sad. It's sad, but that's the reality that we're living. It's crazy stuff. Very, very crazy stuff. But it is well. It is well. Deep breaths. Ooh, by the way, when we're done, please don't log out. I want to ask you something. I just remembered. When we're
Okay.
done, I'll ask you. If you're just tuning in, this is Smooth 98.1, your love music, love life station. It's a Monday morning, 32 minutes past 9 a.m. You're tuned into the Lagos Talks where we have great conversation. My name is Ayokunmi. My guest is still in with me this morning in the person of Dr. Lilian Ochayi. She is a public health physician. We are talking about World AIDS Day 2024. It was yesterday, Sunday, but today is a perfect day to bring it to the fore and have this discussion. I mean, some people, Dr. Lina and I were talking off the air, and she mentioned, someone that feels or felt that maybe it wasn't mainstream anymore. Believe me, it is still very mainstream, even though it might not be spoken about in such loud tones. Though I've seen different platforms where these discussions are had. So we need to take it very, very seriously. You can also join us on the discussion, the conversation as well by sending your thoughts in, your messages into us on WhatsApp on 0809 440 That's 0809 444 0981. You can also give us a call on the studio line. It's 0201 4489981. 0201 4489981 is the studio line. You can also join the live stream on YouTube. We're at Smooth 981 FM Lagos. Smooth 981 FM Lagos. You can drop a comment there as well. And I will definitely be taking it as we get along on the conversation. All right, Dr. Lillian, let us talk about education and the role that it plays because there's a lot of misinformation out there, a lot of myths and so on and so forth where it
Right.
comes to this particular issue. Education is such a powerful tool in reducing the spread of HIV. There's no doubt about that one. Yet, many Nigerians, especially young people, shocking, isn't it? Lack accurate information, about transmission and about prevention as well. Comprehensive sexuality education in schools is still a controversial hot button topic, really, and it's inconsistently implemented. I mean, even at home, so have this conversation at home, it's a difficult thing. I mean,
Right.
for those who grew up way back then, even into the 90s and whatnot, difficult conversations to have about the birds and the bees. And misinformation about HIV, including myths about cures and all sorts of funny things. These issues or these things continue to undermine the efforts to drive home prevention. Now, Dr. Liden, from your professional experience and perspective, are we doing enough to educate young Nigerians about HIV prevention? If not, what are the things that we should focus on to make it a whole lot easier to drive home the point?
Right, thank you for that, Ayo. So, we over the years we have, tried and we're still making efforts to ensure that the population is made aware of what HIV is and how it can be transmitted. Are we doing enough? We are trying, but we still need to do more, right? Because, like I said, fine, in the past few years, we've noticed a decrease in the number of people that are living with HIV, and so, but there's been improvements and all that. So, but we still need to do more to achieve, a higher number of people, so that they don't get exposed to these things. So, but
Okay.
the main thing that we usually preach with HIV prevention are the safe sex practices, right? The A, B, C, and D. A means abstain where possible. So if you can, just don't have sex, right? But then we move to B for those that cannot abstain. B means be faithful. That means stick to one sexual partner, right? That reduces your chances of being infected, because we know that it is sexually transmissible. So C is condom use. Use condoms when having sex. This reduces your chances of being infected. D is don't share sharp objects, and also,
Okay.
yes, getting don't share sharp objects, because we know that the high risk individuals are those that inject drugs, right? So that's a way that it can also be transmitted. So don't share sharp objects, and also to get drug treatment for sexually transmitted infections. So these are ways. Regular testing for people that are sexually active, and we're also encouraging that people get tested, know your status and that of your partner. Early detection is very important. And then we also have the pre-exposure prophylaxis, right? For those that are at high risk, like people that engage in frequent sexual activities, like
Activity.
yes, like female sex workers, and also for people, those among the vulnerable groups, like men who have sex with men also are also among the vulnerable groups. And also, so these people getting but the issue here is that obviously for pre-exposure prophylaxis, it's only effective in people that are negative, HIV negative, right? So if you are negative, then that would be effective. Then also, there's also the post exposure prophylaxis. If you believe you've been exposed to HIV, taking this medication within 72 hours can also help prevent infection. And then we
Okay.
have the antiretroviral therapy, which ensures that people living with HIV have access to these treatments to reduce their viral load, right? So some of these myths I've heard, like our caller mentioned, is that HIV is a death sentence, and it is not, right? People living with HIV can manage the virus effectively and maintain a healthy life and live for many years. I mean, we had the example given to us by our caller today, and people can go on living 20, 30 years and even more, because if they achieve an undetectable viral load, it means they cannot transmit this virus to others. And it cannot be transmitted through casual contact. It is not transmitted through hugging, shaking hands, or
Mm.
sharing spoons or kissing. It cannot be transmitted. It's primarily spread through unprotected sexual contact, sharing needles, and from mother to child during childbirth or breastfeeding. So that's another one that I've heard, right? I even had a friend just ask me if it can be transmitted through kissing. So
Ah,
no, it's only it's only if, for instance, if the person that is HIV positive has a sore or an open wound, right? And in cases someone that is HIV negative and there's blood contact, right? So that's a way that the person that is negative can get this infection. But kissing, saliva, whatever, it cannot be transmitted through that. Another one is that only certain some people also feel like, oh, if someone has you can tell if someone has HIV by looking at them. I know we've heard this one that it doesn't show on the face, right? So
Right. There was
with
a campaign on that
yes,
years ago. You know, they show for face. I remember
exactly.
that very
You know
clearly.
the show for face. Exactly. So with adequate medical care and interventions, people with HIV can have healthy children. They can have when they take these medications, the risk is greatly minimized. And another one is using condoms is not necessary if you are on PrEP. That's the pre-exposure prophylaxis. So while being on that or trying to achieve an undetectable viral load, it's you still need to use condoms as it provides additional protection against other sexually transmitted infections. So it's not only HIV that condoms prevent, right? Other sexually
Mm.
transmitted infections. So because a person is on this pre-exposure prophylaxis doesn't mean that they should still not use condoms. So those are, I mean, the common ones I've heard. And another, HIV cannot be cured. There is no cure for HIV, right? But the treatments so far are effective in managing the virus and allows individuals to live healthy lives. So we just need to do more about spreading this awareness, encourage community leaders to, spread correct information.
Mm.
People can use personal stories, just like our caller here mentioned. He said he's fine, he's healthy, and we can just continue to spread that people can live healthy lives and it is not a death sentence.
Definitely, definitely
Yeah.
not. All right, let me take a message here. This is from Ali. Interesting one he sent in.
Yeah.
He says a friend of a friend was denied a job because he tested positive after a check was done. Now, what was
Right.
sad is that the HR personnel decided to communicate it to the friend who referred the guy to the
Oh
job
no.
interview. What happened to privacy? It's just sad. Apparently, a person living with HIV cannot work at a place where foods are being handled or in hospitality. It just doesn't make sense to me. And he'd like you to clarify on this. Thank you for all you do, guys. Thank you, Ali, for always keeping it tuned. Dr. Lilian, I mean,
Yeah, I mean, this
on
is this is this is what we were talking about earlier, right? Like they are not individual organizations are not supposed to take this test or make it like a precondition for employment. And again, the individual has the right to privacy. They are not supposed to share a person's HIV status with another. They've they've already like hurt the person in a very serious way, and I'm sure that they
mm,
don't know that, but that is wrong on all levels. That is wrong on all levels. And the government needs to continue to, make this thing known to organizations, because like we were saying, they probably don't, if some of them are not even know that this law exists.
like,
Some of
very
them
true.
may have heard of it before and maybe they've forgotten. And there should be penalties in place, like when an organization has been known to do something like this recurrently, there should be penalties for them. So we need to do more on that front.
Okay, so concerning this issue of people living with HIV not being allowed to work in hospitality organizations or where
Right.
foods are actually being handled, because Ali raises a point that you mentioned
Yeah.
handling of sharp objects. Now, could that be a consideration for not wanting to hire someone into that sector because they have to work in the kitchen, knives, sharp objects, and all that? I mean, would that really matter when it comes to transmission, or that's not how it works?
Yeah, so Yes, if there's like sharp objects and all that, and then there's a person having to deal with other people, and then that can be a risk, right? But I mean, if there are precautions taken and all, it's not, I don't think it's enough to completely cut the person off from getting those job opportunities, right? And if they're also taking appropriate measures, like we're talking about this treatment, right? People on antiretroviral therapies, when they are regular on their medications and they keep their viral load really low and undetectable, there
Mm,
is no chance of spreading this infection, right? So even
okay.
if these organizations are paying attention and helping this individual, also supporting, right, which is what they are expected to do. And this person is on medications and their viral load is undetectable. There's no way that the person would be able to transmit these infections through any other form. So these are things that we need to pay more attention to, really.
Very important. Thank you for
Yeah.
those thoughts, Dr. Dre. Let's take our final break. When we come back in, we'll begin to wrap up on the conversation and bring everything home at the end of the day. Don't go anywhere, Lagos, Nigeria, wherever it is you're listening to us. Keep it tuned to Smooth 98.1. I mean, if the person is going to work in the kitchen and all that, maybe that could be a consideration. But even if the person is working, I mean, okay, let's say for example, I'm the chef.
Mm-hmm.
I
Mm-hmm.
have a cut, and
Yeah.
maybe a drop of blood enters what I'm cooking. But I mean,
Mm.
before it gets to the final consumer, even if that happens, that's not the way the blood needs to come in contact with the person for them to be infected, right?
Yes. But still, we still don't want another person to be swallowing up another person's blood or something. But but the thing but the thing is, if for instance, if this person is allowed to work in a food, whatever, a restaurant or something,
Mm,
and the person is actually on these medications, right?
yeah.
There is no, it is, you cannot transmit it, because I mean, there are people that are HIV positive and they are married, they are having sex with their wives, they are having kids.
Mm.
So this is another way it can be transmitted now. So how come those women or the HIV negative people are still negative? So it's just important that we ensure that people are taking their medications, basically.
That is very key because Nigerians have this very bad habit of, oh, I feel better. I won't use my medication again.
I'm not
Very,
feeling
very,
anything.
very, very bad habits. Mm. All right, this is Lagos Talks on Smooth 98.1. The final moments on the conversation this morning. We were having a great time talking about this particular issue. It's been all about World AIDS Day this morning. The theme is Take the Rights Path, My Health and My Rights. We'll be looking at that and, of course, spreading the awareness and the necessary information that needs to be put out there concerning this. I mean, there were different campaigns throughout the years that we've probably had at some point or another. We alluded to one earlier on, it's on the show for face and all that. Those things are not in the mainstream as they were anymore. They should be on a regular because it seems like a number of people have felt very, very relaxed over the years. But
Right.
anyways, thanks for keeping it to. My name is Ayokunmi. Dr. Lilian Ochayi is my guest, and she has been giving us all the knowledge that we need to arm ourselves with this morning. Let me take a message here from Dakbo, who is still at Ogunlano Drive this morning. Dakbo, I'm monitoring your movements, as it were. He says Irving Magic Johnson, the great basketball player formerly of the LA Lakers, has been managing the HIV/AIDS virus almost from the inception of the disease, and he's looking healthier and more ship-shape than many of his contemporaries. Stigmatizing people with sicknesses isn't correct, although sin is the diabolical avenue which attracts diseases into our respective lives. I'm not sure I agree with that one, Dakbo. Abstinence from pornography, promiscuity, and affectionate lust will do such people a whole world of good. I mean, we've established that it's not only through sexual activity that one can actually contact this particular disease. So we need to also put that into perspective. I get where you're coming from, but we
Yeah.
need to also look at it from a holistic perspective. Not everybody who has this particular disease or infection got it in one way. Let's leave room for that possibility. But thank you for sharing your thoughts there, Dapo. All right, Dr. Lillian,
Yeah.
let's talk about the role of community. Community definitely plays a big part. I mean, they are at the heart of the HIV/AIDS response, and they provide support systems. They advocate for better services as well. They also, should be or are involved in educating others about prevention and treatment as well. What more can they do, and how can they be better equipped to support this cause?
Right. Thank you for that. The communities, yes, like you said, they play a crucial role in combating HIV and AIDS by providing support, raising awareness, like we were saying, if appropriate, accurate information is being, spread across to communities about how HIV can be transmitted and
Mm,
treated, it will help to dispel these myths and reduce stigma. So, like, we were talking about how it can be transmitted and how a lot of people feel, oh, you can get it through touching or sharing utensils or things like that. It is not only and it's also not only through sexual intercourse, even from a blood transfusion. Okay, if a person is transfused with a HIV infected blood, you can also get it mother to child transmission, like I mentioned earlier. So
right.
it doesn't mean that it's only from being promiscuous or things like that. So these are things that we also need to ensure that the communities are made aware of to reduce stigma, because a lot of this stigma comes from the people around, these individuals, especially when they are made aware of a person's HIV status. So we need to encourage and ensure that awareness and proper education is made. Then support networks, peer groups, also to offer emotional and social support, assisting individuals in coping with this diagnosis, and also make
Okay.
sure that they're adhering to treatment. Then testing, treatment, advocacies, cultural relevance, also improving the effectiveness of prevention should also, but ways we can equip communities: continuous training, capacity building, funding and resources. So increasing funding for community organizations to enhance their service capacity, and also outreaches can help. Partnership with
Okay.
healthcare providers, also to establish collaborations with these providers to improve access to medical care. Also within, rural areas where there might not be so much access to healthcare, there also needs to be partnerships and, collaborations to ensure that people can get these healthcare services in those areas. Mental health support, also to offer these resources for individuals living with HIV, can help them to cope emotionally. Involving these key populations, like those that are at a higher risk of being infected, also would also help. Public engagement campaigns, and, also things like what we're doing now, like trying to create awareness, people listening
Yes.
in,
Yes.
getting more information. This is also a way to debunk a lot of these myths, and to also help people be better aware of what it really is and ways it can be transmitted, and also to show support to people around them in their communities, because this would go a long way for, those that are around us. So these are the ways that people in the communities can help, and we also need to make sure that we offer
mental health support in any little way that we can, because people could be depressed, could lose their
True,
self-esteem, could,
true.
could want to kill themselves, just like our caller mentioned. So we also
Mm.
need to support. We should not add to the overwhelming feeling that some of them may have. Instead, we should give much support as much as we can. So yeah, I think that's what we can do on our end from the communities.
All right, absolutely fantastic. Thank you so much for, sharing those thoughts, Dr. Lilian, and joining me this morning to have this conversation. It's been a very enlightening one, and I really hope we've been able to take a couple of things and, of course, dispel a number of myths and remind
Yeah,
ourselves that this is something that is still living with us. Let's not
right.
lose God, as they say. Once again, Dr. Lilian Ochayi, it's been a pleasure having you.
Thank you very much. It was very nice to be here. Thank you.
Alrighty. And it's as we've heard today, fighting HIV/AIDS, it goes beyond medicine. It's about rights, it's about dignity, it's about community action as well. And we need to remember that health is a right for everyone. It's not just a privilege for a few. So to you out there listening, we can continue this conversation on the pages of social media. You can share your thoughts with us using the hashtag World AIDS Day 2024. You can tweet at smooth981FM. That's on X or Twitter, anyone that floats your boat. You can also tweet at me at Ayokunmi_K. I'm on X and Twitter. Let's have conversations there as well. And thank you for being a part of Lagos Talks this morning, keeping it tuned, sending the messages and calls as well. Always a pleasure having you on the show. Don't go anywhere because the Smooth Breakfast will kick on. There's more great music lined up for you. It's all about getting you in the right frame of mind to tackle a money-making Monday. My name is Ayokunmi. Keep it tuned.
Woo.
What do you say?